Hello and welcome to another segment of Simply Healthy. You know, we always enjoy empowering you on how to take care of your body temples physically, emotionally, and most importantly, spiritually. You know, we all at some point experience anxiety in our lives. You know, you might feel anxious when faced with a problem at work, before taking a test or making any important decision, you know. But anxiety disorders involve more than temporary worry or fear. Today with me in studio is Dr. Stephanie Hutchinson. She's a clinical psychologist and she's also an assistant professor at the University of the Bahamas.
Good
Welcome.
morning. Good morning.
Welcome to Simply Healthy.
Thank you.
Is there anything else you would like our listening audience to know about you before we go into our discussion of today?
I think what you've covered is good.
Okay.
We don't want to muddy the waters with distracting people with other information.
Okay.
Yeah.
Wonderful. Dr. Steph, today we are going to look at the topic of anxiety disorders.
Mm-hmm.
Anxiety disorders. Can you tell our listening audience just what is anxiety?
I think the thing to remember about anxiety, one, is that we all experience it.
Yes.
And I think you alluded to that as you opened this segment. But the nature of anxiety is that we have apprehension about something that we think may happen,
Yes.
even though it may not be happening in actuality. So I think that's probably the key to remember. It's more anxiety. It's more, not to use the word anxiety, but it's more apprehension. There may be an emotional component about it, a cognitive thinking component about it, and it's usually about something that we think may happen, a future event.
Okay.
Yeah.
So I have definitely experienced some
We all have.
anxiety.
We
Yes.
all have.
Mhm.
You said about it. People who I teach at the university, students sitting in to take a test, and they're anxious about, will I pass this,
Yes.
or have I studied enough to prepare for this? Yeah.
And the what ifs.
The
what ifs
ifs.
going into the
What
future.
ifs, right? Yes.
Okay. What are some anxiety disorders as a clinical psychologist? Can you elaborate
The
on
thing
some of those for
about
us?
anxiety disorders is that they're some of the most common psychological disorders, meaning that many people, maybe at some point in their life, may get to a point where they have an anxiety disorder or have symptoms that may not quite meet criteria for an anxiety disorder. So they're very common. I think that's the thing I want to kind of convey. And people may not realize that. So in the last few years, in the psychiatric community, there's been a kind of shift in terms of what are now classified as anxiety disorders. So
Yes.
some have been brought into the classification system and some have been dropped.
Okay.
And so according to the DSM-5, and the DSM is the Diagnostic Statistical Manual for Mental Disorders, so that's kind of like, for want of a better word, the Bible of psychological disorders. And there's also the International Classification of Diseases, which is another classification system. So according to the DSM-5, meaning that's the 5th edition, these are the 9 disorders that would constitute anxiety disorders. We have separation anxiety disorder.
Oh yes, I experienced that one.
Selective mutism for your daughter or you. Specific phobia, social anxiety disorder, panic disorder, agoraphobia, generalized anxiety disorder, and then 2 that are not as common, the substance-induced anxiety disorder, and then there's an anxiety disorder due to medical condition. But
Yes.
the ones that I would probably see more in practice and people may have more experience with are the specific phobia, the social anxiety disorder, the panic disorder, and the separation anxiety disorder. And that's a new one because new in the sense that separation anxiety disorder was usually considered a disorder of childhood.
Okay.
And so it was usually diagnosed, it's usually probably diagnosed in childhood. But the change in the DSM-5 is that it's now it's now not considered a disorder of childhood and adolescence. It's recognized that there may be remnants of this presenting in adulthood. So I don't know if that's what you were talking about having separation and anxiety disorder.
Definitely.
Yes.
I experienced that
Yes.
separation disorder.
Yeah.
Do you want to speak to any of of those other disorders? Elaborate on them a bit for us, actually.
The specific phobia and probably the social anxiety disorders are ones, like I said, I would experience more in practice and people may have experience with in life. Let's start with specific phobia.
Yes.
There are some people who are deathly afraid of flying. They will not fly
Okay.
because they have a fear of flying. There's some people, and let me look at, because there's certain ones that are specific. Like there's some people who have a phobia about a specific animal. They may be afraid of snakes or dogs or some other kind of animal.
Right.
You may have, so like I said, the situational one would be the fear of flying, fear of elevators, those heights, those kinds of things.
Okay.
This is an interesting one. I just had some blood drawn the other day. There's some people who have a fear of needles.
Definitely.
So if you have to go for blood work, you're not going to go.
Okay.
Because you don't want to have the injection.
Get stuck.
And I was talking with the phlebotomist who was drawing the blood, and she was saying some people don't follow up for years because of the fear
Wow.
of
Getting stuck.
with a needle. And for those of us who kind of grin and bear it, we're like, well, just, suck it up. But for someone who has a phobia, the response to the situation is beyond what would normally be expected, and it could be debilitating in a sense. Like, for example, someone who has a fear of, let's say, elevators. They have a phobia about elevators or being in spaces like that.
Yes.
They may avoid any building where they have to take an elevator, or they may take the stairs no matter how tall that building is.
Right.
Or let's say for something like someone who has a fear of flying. Can you imagine if you have a phobia about flying, and let's say you develop a phobia about flying, and you're a flight attendant?
Wow. Cannot be a flight attendant.
You can't be a flight attendant anymore.
No.
Or you're a business executive and you have to fly often for your work. You
There
may
goes an
either
opportunity.
you miss opportunities for promotion or advancement because you're avoiding those situations.
Yes.
But the good thing is about specific phobias is that they respond very well to cognitive treatment and cognitive behavioral treatment. The challenge is you're going to have to be exposed to your fear.
Yes.
To get
over
your fear.
it. Okay.
Yeah, but it's
okay.
Common. People who are afraid to go to the dentist. I think this is some more common than many of the other ones. Yeah.
Okay. Right now, believe it or not, we go into a break.
Okay.
And we'll be right back
All right.
to continue on this discussion.
Thy word is a lamp unto my feet and a light unto my path. Word SBC 88.3 FM.
I am Pastor Donald Roll, pastor in the Central States Conference, and I want to remind you that if you want to walk on water, you must get out of the boat. If you want to do God's great will in your life, you must trust Him and move now. I want to remind you that you are listening to the station that helps you to live by every word that proceeds from the mouth of God. That's Word SBC 88.3 FM, and we want you to keep listening each and every day.
At the sound of your great name, every fear has no place. At the sound of your great name, the enemy, he has to leave. At the sound.
Hello and welcome back. Today with me in studio is Dr. Stephanie Hutchison, and we are looking at the topic of anxiety disorders. Just before we went to the break, Dr. Hutchison was elaborating on some of the different types of anxiety. And I just want you to speak to social anxiety.
Okay. The social anxiety disorder was formerly called social phobia. And in this particular disorder, the individual finds themselves, they're fearful or they're anxious or they're avoidant when it comes to social situations.
Yes.
So social interactions, particularly where they think people are observing them, are they find it really anxiety provoking, really stressful, and so they would rather avoid these situations than actually being in them. They may be overly conscious of if they're in an eating situation. They go to dinner, they might, oh my gosh, people observing them eating or drinking, or where they have to perform in front of others.
Okay.
And so the thoughts that kind of run through their inner dialogue, their cognitive dialogue, is that they're going to be embarrassed somehow in this social situation, or people may reject them, or they may be humiliated, or people are negatively evaluating them. So there's a rich thought life, even though it's a distorted thought life, going on with someone in terms of the social anxiety disorder. So social interactions, going to a party, going to a meeting, a conference. Let's say it's a professional conference where you're networking. That would be very anxiety provoking for someone with this condition.
Okay.
Yeah.
Do you find that more persons who are introverts suffer with this disorder?
See,
Or-
I think that's what people tend to think. We had this discussion in my church just a couple of days ago, and recognizing that the thing to remember with the introverted personality type is not necessarily that they are shy, or they're worried that people are going to negatively evaluate them. It's more a matter of, and I'm using a term that I've been reading about because I think it actually explains this. It's more a matter of where they draw their energy from and how they
Okay.
connect with people. Like someone that's an introvert, they have to put a lot of themselves emotionally into a situation and interact. And then that can be quite draining emotionally, so they have to withdraw and recharge.
Yes.
Someone who's an extrovert gains energy in terms of being in social settings. So
Okay.
someone who's an introvert, it doesn't mean that they're socially anxious. It just means that they don't need as much to be around as much stimulation in social interactions as other people. Their inner life is very rich, and they don't need as much in terms of interaction. They can be on, and then they need to withdraw and be off. So it's not that they're anxious. It's just they're more of a reserved type.
Okay.
So I think sometimes we tend to confuse the two.
Okay, so that social anxiety can anyone can fall into that under that umbrella.
In terms of social anxiety disorder,
Yes.
it could be in someone who's an extroverted type or an introverted type,
Introvert.
using the example that you
Okay,
just
okay.
mentioned.
Panic disorder. Can you speak to that for us?
Panic disorder is an interesting condition because the disorder usually, the disorder is usually attributed to a series of panic attacks that an individual has experienced. And the thing with panic attacks is that the individual who's having a panic attack, it is very real. There are physiological symptoms. They may feel like their heart is pounding.
Racing.
They feel like they're having a heart attack. They may be sweating. They may feel that they have a sense of impending doom. They may feel that, like I said, they're pulsing. Their heart is beating really fast. Their pulse is elevated. So there's real physiological symptoms that they're experiencing to such a degree that many of them who may be having a first panic attack show up at the emergency room
Yeah.
because they think they're having a panic attack. I mean, a heart attack.
Right.
Tests are run and they come back, oh. So sometimes the first recognition that there is a problem is that the emergency room visit, you have the medical evaluation, your heart is fine, and you get the first inclination, okay, you probably just had a panic attack.
Yes.
And then because of the physiological nature of it and what happens to the individual, there's anxiety and fear that this is going to happen again.
Yes.
And so recurrent episodes, then they meet diagnostic criteria for a panic disorder. But it's very scary because, like I said, because of the physiological nature of the symptoms. You can see it. The person may feel that they can't breathe and they're short of breath and all of the other stuff that go along with it, but it's a panic attack.
Okay. Persons who experience these anxiety disorders, does medication help them, or?
It depends. Sometimes you may have, for the physiological aspect of it, they may be managed in terms of with pharmaceutical medication, but the predominant way of treating panic disorders is either cognitive behavioral therapy or behavioral therapy. So you're targeting and attacking the thinking, the cognitions, and the behavior
Okay.
to effect change. And so these types of therapies have been most effective with anxiety disorders. So they're very treatable once they're recognized, diagnosed, and a treatment protocol is put into place. So you may
Okay.
have medication to go along with it, but the more effective mechanisms that are used are cognitive behavioral and behavioral treatments.
Okay, okay, wonderful. This might seem elementary, but is anxiety a feeling or emotion?
With anxiety, you have two components. You have a cognitive component. Whenever we talk about cognitive, you're thinking.
Mind.
And you have like an emotional response. So you may have a bit of both, and sometimes it's like which comes first, chicken or the egg. But when you think about it, let's use an example just in terms of general anxiety. Let's say you have your son or daughter goes out, they're late in coming home,
Yes.
and you're starting to get anxious. You start to think cognitions.
Wondering.
What has happened? Has this happened? Has that happened? So that's the thinking aspect of it.
Yes.
And then you may have some feelings about that. You might start to feel, I guess, a little more
Afraid.
agitated or afraid. So you have both components of it.
Okay.
Yeah.
Okay. Stress. Is stress different from anxiety?
Stress, there are lots of definitions I've seen for stress, but the simplest one I've seen is that it's a reaction to change in our lives.
Okay.
And that there's a eustress, the good stress, so to speak, and then there's the distress, the kind of the stress we try to avoid. So it's an adaptation to a change in our lives in terms of
Okay.
how we respond to that. And the component of stress that's related to anxiety is that there's a thinking component, and then there's also a physiological or emotional component as well in terms of how we respond to stress.
Okay.
Yes.
Okay. All righty. How common is it? And we're getting ready to go to the break, so I'm going to ask you this: how common are anxiety disorders right here in the Bahamas?
I wish I could give you those
No
numbers.
stats. That's fine.
I mean, I can give you the U.S. stats in terms of when you
okay.
think about anywhere from 10 to 20% of a population of millions of people may present with anxiety disorders, and it's considered one of the more common ones.
Yes.
And so let's say I can't remember what the population of the U.S. is, but I think it's let's say it's 100 million or more
Okay.
than that, and you have 10% of that. That's a whole lot of
It's
people.
a lot.
Yeah, so I would not be surprised in terms of proportionally we see the same kind of numbers, but hard and fast I couldn't tell you.
Okay, we're going to a break, and we will be right back to continue our discussion on anxiety disorders.
Hi, this is your sister in Christ, Laverne Stirrup from the Morning Joy Show. Why not join me every weekday morning from 8 to 10 for your inspiration and motivation from the Word of God? Come on, let's enjoy each other's company. Tune into Word SBC 88.3 FM for Morning Joy and get your joy on.
He says, love me.
Word SBC 88.3 FM is a listener-supported station. In order to improve our services and continue the work of taking the gospel across the airwaves, we wish to partner with you. If you feel impressed to contribute to this work with your financial support, we invite you to give us a call at 341-4021 or by emailing atbbahamas@gmail.com. You can help the Word be a lamp and light in a dark world. We look forward to partnering with you.
Hello and welcome back to Simply Healthy. We're happy that you've joined us today. Today we are discussing the topic anxiety disorders, and we have Dr. Stephanie Hutchinson with us in the studio, who is a clinical psychologist, and she's also assistant professor at the University of the Bahamas. Dr. Hutchinson, how does anxiety disorders develop? How do they develop?
Well, let's talk. Let's kind of talk specifically about specific phobias. Let's look at that one.
Okay.
Because for some of them, either through observation or experience, you may have someone move from just general anxiety that we normally experience in life to a
Yes.
more defined disorder. So with the specific phobia, you may have someone who's actually had a traumatic experience, or who may have had an experience where they now fear the situation or the object that caused the fear. So let's say for someone, we talked about fear of flying earlier.
Right.
Someone may have been on a flight that was really turbulent, and that the thinking that maybe I'm going to die, the physiological symptoms that went along with that, the trauma of that experience may be so much that the person decides, not decides, because it's usually not something that they consciously decide to do, that they now find that they avoid and they're phobic about that situation.
Yes.
So it's usually either through exposure, either direct experience, or through witnessing. But then there's a segment of people who have phobias where they're not really sure how it developed, but they
Okay.
just find that they're
Afraid of certain
situations. And like, I use fear loosely because phobia is beyond a fear. It's an inordinate response to a specific situation
Okay.
or an event.
That you
and
really don't have any control over.
Yeah, and even though people, for example, someone who may be phobic about snakes, using that as an example, just looking at a picture of a snake may evoke the same the same response as if they had a snake in the room with them,
Yes.
which is generally not most people's experience with snakes.
Right.
Right. We all probably don't really like snakes, but we have different kind of.
I know
experience
persons
with
like that.
Right. So usually exposure, witnessing, and then there's a segment of people who have specific phobias where they're not quite sure how it developed.
Right.
Okay, so those are the things to remember, that, and the situation that they exposed to elicits that reaction. So they may be fine in every other area of their life, but when they deal with going into an elevator, taking a flight, or let's talk about Nassau. We have some situations in terms of how people drive in this country that are very fear-inducing
Yes.
and anxiety-inducing. So let's say someone who's been in a car accident may actually develop a phobia about driving again
Yes.
because the experience, or they may develop a post-traumatic stress disorder, which
Yes.
used to be under anxiety disorders, but not anymore. So they may develop that response in reaction to that experience, that event, or witnessing. Yeah, witnessing
Okay.
it. Yeah.
Okay. Wonderful. Separation anxiety. Let's speak to that.
Now, this is an interesting disorder. I'm not quite sure all of the details that went into why this is no longer a disorder of childhood, because for a very long time, when it was introduced in the DSM, it was classified as a disorder of childhood and adolescence.
Okay.
Okay, so now it's not. It's now under anxiety disorders, and I think, particularly in childhood, if you've seen it, you may not have had a name for it, but you recognize it.
Right.
So in this situation, the individual is extremely fearful or anxious about being separated from their caregiver or the person they're attached to, the mom, the dad, whoever's taking care of them.
Yes.
And it may be like developmentally inappropriate, so it's not really appropriate to their age. And their concern and their fear and their anxiety is that something is going to happen to this person if I'm separated from them. Some kind of harm
with
is going
them.
to come to them. It may cause nightmares, particularly in children. It may cause physical symptoms of distress. It may develop in childhood, and this is where the change in recent years has come in. But there's a recognition now that some of these symptoms may persist into adulthood.
Yes.
What that looks like I said, because this is a more recent change in terms of the diagnostic criteria, how that looks in adulthood, it makes me wonder if this could be a precursor to someone who we would diagnose as having a dependent personality disorder. Like they're so attached to the people in their lives that they don't want to be separated from them. So I'm wondering if there's probably a connection there.
Or fear of something
Right.
happening to that
But
person.
what it may look like is, those when children go off to school for the first time, and it can be screaming, crying for the parent or the child. I don't know who's worse sometimes. So So it kind of looks like that
Okay.
to some degree, but you may have, like I said, it may be difficult for the individual who has the anxiety disorder. They don't necessarily want to be separated from their caregiver or their parent because of the thinking and the emotional distress that something can happen to them when they're separated.
Okay, okay. In general, are there any treatments for persons with anxiety disorders, generally speaking?
I think we kind of touched on that a little earlier.
Oh, yes, we
Specific
did.
phobia. You're going to have to face your fear. But it's done through a process with the psychologist or the psychotherapist who's working with you in terms of gradual exposure. So gradual exposure, targeting and isolating what are your thought processes about the situation and trying to restructure and correct those. And the behavioral aspect of it is helping you to change what you're doing so that you can function in a way that's more beneficial to you. And so this cognitive piece, there's the behavioral piece. In some situations, medication may go along with that, but it's not usually long term because the cognitive behavioral and /behavioral therapies tend to be very effective.
Okay, Dr. Tajutan, do you have any wrap-up comments for our listening audience today?
As I think we started out saying this, but I just wanted to say that anxiety disorders are very treatable.
Yes.
Many people probably present to their family doctor or practitioner with some of these symptoms, and if there's a recognition that they exist, then referral to a mental health professional will probably go a long way towards helping a person lead a more effective and happy life. But they're very treatable as a psychological condition, and they're more common than people realize.
Well, thank you so much for joining us today
You're
on Simply Healthy. I'm sure that our listening audience is much more educated on the topic of anxiety disorders. And I would just like to leave a Bible text with you, my listening audience. Philippians chapter 4, verse 6 to 7. It says, "Do not be anxious about anything, but in everything, by prayer and petition, with thanksgiving, present your requests to God, and the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus." Do have a wonderful day. I'm Nathalyn LaCroix for Simply Healthy. If you would like more information on the topic covered, email me at simplyhealthy242@gmail.com. That's simplyhealthy242@gmail.com. Or you can call me at 341-4021 or 323-0610. It's not complicated, it's just simply healthy.